If you've been told your test results are normal, but you're still feeling exhausted, dealing with unexplained joint pain, or noticing your memory isn't what it used to be, what I'm about to share could change everything. There are 4 common medical tests that, while helpful for diagnosis, can actually trigger a cascade of inflammation in your body without you or your doctor realizing it. And the worst part? The symptoms don't show up immediately, which means by the time you notice something's wrong, the damage has already begun. My name is Dr. Helen Brooks, and I'm a board-certified internist with over 20 years of experience helping patients understand the hidden connections between routine medical procedures and chronic inflammation. I've seen firsthand how certain diagnostic tests, while medically necessary, can set off inflammatory responses that affect everything from your cardiovascular health to your cognitive function. Today, I'm going to walk you through exactly which tests these are, why they trigger inflammation, and most importantly, what you can do to protect yourself. Before we dive in, if you haven't subscribed yet, I strongly recommend hitting that subscribe button and turning on notifications so you never miss another health tip designed specifically for you. If you find this information valuable, please leave your questions and video suggestions in the comments below. I read every single one, and your feedback helps me create content that truly addresses your health concerns. Let me start with a story that changed how I approach patient care. About 3 years ago, I had a patient, Mrs. Margaret Thompson, a 72-year-old retired librarian, who came to see me complaining of what she described as feeling off for several months. Margaret had always been incredibly health conscious. She walked every morning, ate a balanced diet, and never missed her annual checkups. But something had changed. She told me, with tears in her eyes, "Dr. Brooks, I used to finish my 3-mile walk and feel energized. Now I can barely make it around the block without feeling like I need to sleep for hours." Her daughter, who accompanied her to the appointment, mentioned that Margaret had also become unusually forgetful, missing family gatherings, and repeating the same stories within minutes. As I reviewed Margaret's medical history, something caught my attention. 6 months earlier, she'd undergone a series of diagnostic procedures for persistent abdominal discomfort. The tests came back normal, which should have been reassuring. But Margaret's decline began right after those procedures. That's when I started connecting the dots. The tests themselves, while ruling out serious conditions, had triggered something else entirely, a low-grade inflammatory response that was slowly affecting her entire system. This realization led me down a path of research and clinical observation that revealed a pattern I'd been missing for years. The first test I need to warn you about is the contrast-enhanced CT scan. Now, before you panic, let me be clear, this is an incredibly valuable diagnostic tool that saves lives every single day. But here's what most patients, and even some healthcare providers, don't fully appreciate. When you receive that contrast dye, whether it's injected into your vein or taken orally, your body doesn't recognize it as a natural substance. Your immune system sees it as a foreign invader, and it responds accordingly. The contrast agent, typically iodine-based, can trigger what we call oxidative stress. Think of oxidative stress as your cells being exposed to internal rust. This process generates free radicals, unstable molecules that damage your cell membranes, proteins, and even your DNA. For most people, the body clears this contrast within 24 to 48 hours. But during that time, and sometimes for weeks afterward, there's an inflammatory response happening at the cellular level. Your cytokines, which are chemical messengers in your immune system, become activated. These cytokines travel throughout your body, signaling inflammation in your blood vessels, your joints, your brain, and your gut. Let me tell you about Mr. Robert Chen, a 67-year-old accountant who came to my office 6 weeks after undergoing a CT angiogram to evaluate chest pain. Robert's heart was fine. The scan ruled out any blockages, but he developed something unexpected. He started experiencing severe brain fog, joint stiffness in his hands that made it difficult to type, and a persistent low-grade fever that would come and go. When I ran comprehensive inflammatory markers, his C-reactive protein was elevated, his erythrocyte sedimentation rate was high, and his white blood cell count showed signs of chronic activation. Robert looked at me confused and asked, "But Dr. Brooks, they said my heart was perfect. How can I feel worse now than before the test?" This is the insidious nature of contrast-induced inflammation. The test itself doesn't cause symptoms immediately. But over the following days and weeks, as the inflammatory cascade builds, patients start experiencing fatigue, cognitive difficulties, joint pain, and sometimes even depression. The connection isn't obvious because there's a delay between the exposure and the symptoms. Robert's story had a good ending. Once we identified the source, we implemented an aggressive antioxidant protocol, increased his hydration dramatically, and supported his liver and kidney function to enhance detoxification. Within 2 months, his symptoms resolved. But those 2 months were frightening for him and his family. If you're still watching and finding this information helpful, comment 1 below to let me know you're following along. Your engagement helps me understand what content resonates most with you. The second test that can trigger hidden inflammation is one that surprises most people: the coronary angiogram or cardiac catheterization. This procedure is absolutely life-saving for people experiencing heart attacks or severe coronary artery disease. I'm not suggesting anyone avoid this test when it's medically necessary, but we need to talk about what happens during and after this procedure that most patients aren't prepared for. During a cardiac catheterization, a catheter is threaded through your artery, usually from your wrist or groin, all the way to your heart. Contrast dye is injected, and X-ray images are taken to visualize your coronary arteries. The procedure itself causes mechanical trauma to your arterial walls. Even with the most skilled interventional cardiologist, there's unavoidable disruption to the delicate endothelial lining of your blood vessels. This endothelial layer is crucial for regulating inflammation, blood clotting, and vascular tone. When it's disrupted, your body initiates a repair process that involves, you guessed it, inflammation. But there's more. The contrast dye used in these procedures can temporarily impair kidney function, especially in people who already have some degree of kidney disease, diabetes, or dehydration. When your kidneys are stressed, they can't efficiently filter out inflammatory byproducts. These inflammatory molecules accumulate in your bloodstream, affecting distant organs including your brain, joints, and digestive system. I'll never forget Mrs. Patricia Williams, a 74-year-old former nurse who underwent an elective cardiac catheterization after a stress test showed some abnormalities. The procedure revealed only mild coronary artery disease that didn't require stenting. Patricia should have felt relieved. Instead, 3 weeks later, she developed what seemed like a completely unrelated problem. She started experiencing severe digestive issues, chronic diarrhea, bloating, and food sensitivities she'd never had before. She also noticed her thinking wasn't as sharp. She'd lose her train of thought mid-sentence and struggled to remember names of people she'd known for years. Patricia came to me after seeing 3 different specialists who couldn't find anything wrong. When I asked about recent medical procedures, she mentioned the cardiac catheterization but dismissed it, saying, "That was over a month ago, and they said everything looked fine." But I suspected a connection. The procedure had triggered a systemic inflammatory response that affected her gut microbiome and created increased intestinal permeability, what many people call leaky gut. This allowed inflammatory molecules and partially digested food particles to enter her bloodstream, creating an ongoing inflammatory cycle. The inflammation also affected her brain, contributing to the cognitive symptoms. Patricia's recovery required a comprehensive approach. We focused on healing her gut lining with specific nutrients, reducing overall inflammation with an anti-inflammatory diet, and supporting her body's natural detoxification pathways. It took 4 months, but she eventually returned to her baseline health. She told me, "Dr. Brooks, I wish someone had warned me this could happen. I would have prepared differently, made sure I was better hydrated, started antioxidants before the procedure, and been more vigilant about my diet afterward." But if you thought those 2 tests were concerning, wait until you hear about the third one. This one affects millions of people every year, and almost no one talks about the inflammatory consequences. The third test is the colonoscopy with bowel preparation. Now I know what you're thinking. Colonoscopies save lives by detecting colon cancer early. I'm absolutely not telling you to skip this crucial screening. But I am going to explain why the bowel preparation process can trigger significant inflammation, especially in people over 60. The bowel prep involves drinking large volumes of laxative solutions that completely empty your colon. This process doesn't just remove stool, it strips away your protective intestinal mucus layer and dramatically alters your gut microbiome. Your gut contains trillions of beneficial bacteria that regulate your immune system, produce vitamins, protect against pathogens, and maintain the integrity of your intestinal lining. When you do a bowel prep, you're essentially creating a temporary sterile environment in your colon. Those beneficial bacteria are flushed out along with everything else. Here's where the inflammation comes in. Your gut microbiome normally keeps inflammation in check by producing short-chain fatty acids like butyrate, which are powerful anti-inflammatory compounds. When the microbiome is disrupted, inflammation increases. Additionally, without that protective mucus layer, the cells lining your intestine become more vulnerable to damage and increased permeability. This means bacterial components and food particles that should stay in your gut can cross into your bloodstream, triggering an immune response. Let me share the story of Mr. James Mitchell, a 68-year-old retired engineer who came to see me complaining of severe fatigue and joint pain that started about 2 weeks after his routine colonoscopy. James had never had any digestive issues before. The colonoscopy itself was normal, no polyps, no signs of disease, just a clean bill of health. But James didn't feel healthy. He told me, "I can barely get out of bed in the morning. My knees and hips ache like never before, and I've lost my appetite completely. Food just doesn't appeal to me anymore." When I examined James, I noticed he had developed mild swelling in his ankles and his skin had a slightly gray tone, suggesting poor circulation and oxygenation. His inflammatory markers were significantly elevated. But what really caught my attention was his description of his bowel movements since the colonoscopy. He was having loose stools several times a day, with urgency and cramping. His gut had not recovered from the preparation. I explained to James that his gut microbiome had been severely disrupted and hadn't properly recolonized with beneficial bacteria. Instead, potentially harmful bacteria had taken over, producing inflammatory compounds and toxins that were affecting his entire body. The joint pain wasn't arthritis, it was systemic inflammation originating from his gut. The fatigue was partly due to the inflammation and partly due to malabsorption of nutrients, because his damaged intestinal lining wasn't functioning properly. James's recovery focused heavily on rebuilding his gut microbiome with specific probiotic strains, feeding those bacteria with prebiotic fibers, healing the intestinal lining with nutrients like L-glutamine and zinc, and reducing inflammation with omega-3 fatty acids. We also temporarily modified his diet to remove foods that could further irritate his gut. Within 6 weeks, James felt like himself again. He later told me, "I had no idea a routine screening test could have such profound effects. I wish I'd known to take probiotics and prepare my gut better." The fourth and final test might shock you because it's one of the most common procedures performed in hospitals worldwide. I'm talking about the intravenous contrast used for various imaging studies, but specifically, gadolinium-based contrast agents used in MRI scans. Gadolinium is a heavy metal that's attached to a chelating agent to make it safer for injection into your body. In theory, this chelating agent keeps the gadolinium bound, so it can be excreted by your kidneys without causing harm. In practice, it doesn't always work perfectly. Studies have shown that gadolinium can deposit in various tissues throughout your body, including your brain, bones, and liver. These deposits can persist for months or even years after the MRI. Here's the inflammatory connection. When gadolinium accumulates in tissues, it triggers a chronic low-grade inflammatory response as your immune system tries to deal with this foreign metal. This inflammation can manifest in numerous ways: chronic headaches, muscle and joint pain, skin changes, brain fog, and sometimes a condition called nephrogenic systemic fibrosis in people with kidney disease. Though this is rare. Mrs. Eleanor Santos, a 76-year-old artist, came to my practice 18 months after undergoing multiple MRI scans with gadolinium contrast for evaluation of persistent headaches. The scans never revealed the cause of her headaches, but something worse happened. Eleanor started developing strange neurological symptoms. She'd have episodes where her hands would tremble so badly she couldn't hold a paintbrush. She experienced shooting pains down her legs, balance problems, and what she described as a constant buzzing sensation in her head. She'd seen multiple neurologists who ordered more tests, including more MRIs with contrast, but everything came back normal. When Eleanor came to me, she was desperate and frightened. She said, "Dr. Brooks, the doctors keep telling me there's nothing wrong, but I know my body. Something is very wrong." I asked about all the imaging she'd had done, and when she told me she'd had 7 MRI scans with gadolinium contrast over a 2-year period, alarm bells went off. I ordered specialized testing that's not commonly done: urinary gadolinium levels. The results showed elevated gadolinium excretion, suggesting ongoing mobilization of stored gadolinium from her tissues. Eleanor's treatment was challenging. We used specific chelating agents to help her body eliminate the stored gadolinium, supported her detoxification pathways with supplements and dietary changes, and used anti-inflammatory protocols to reduce the inflammatory response her body was mounting against the gadolinium deposits. Her recovery was gradual, taking over a year, but she eventually regained her ability to paint, and most of her neurological symptoms resolved. She told me, "I feel like I got my life back." I was starting to believe it was all in my head. Now, you might be wondering, Dr. Brooks, are you saying I should refuse these tests if my doctor orders them? Absolutely not. Each of these diagnostic procedures can be life-saving when used appropriately. What I am saying is that you need to be informed about the potential inflammatory consequences and take proactive steps to minimize them. Let me give you practical strategies for each of these tests. If you're scheduled for a CT scan with contrast, here's what you should do. First, hydrate aggressively. Drink at least 8 to 10 glasses of water the day before, the day of, and 2 days after the test. This helps your kidneys flush out the contrast more quickly. Second, consider taking N-acetylcysteine, a powerful antioxidant, starting 2 days before the test and continuing for 3 days after. Studies have shown this can reduce contrast-induced kidney damage and oxidative stress. Third, load up on antioxidant-rich foods like berries, leafy greens, and green tea in the days surrounding your test. These provide your body with the tools it needs to combat oxidative stress. For cardiac catheterization, the preparation is even more critical. Make sure you're well hydrated in the days leading up to the procedure. Ask your cardiologist about taking N-acetylcysteine before the procedure, as this has been shown in research to protect against contrast-induced kidney problems. After the procedure, continue aggressive hydration and consider adding magnesium supplementation, as magnesium supports vascular health and helps modulate inflammation. Also, focus on anti-inflammatory foods, wild-caught fatty fish, turmeric, ginger, and plenty of vegetables. Avoid inflammatory foods like processed meats, refined sugars, and excessive omega-6 fatty acids from vegetable oils. If you're preparing for a colonoscopy, here's my protocol. Start taking a high-quality probiotic supplement at least 2 weeks before your procedure. This builds up your beneficial bacteria population. After the colonoscopy, immediately restart your probiotics, using high doses initially, and continue for at least 6 weeks. Add prebiotic fibers to feed the beneficial bacteria. Things like partially hydrolyzed gar gum, inulin, or simply eating more foods like garlic, onions, asparagus, and bananas. Consider taking L-glutamine powder daily for several weeks after the procedure to help heal and seal your intestinal lining, and eat fermented foods like sauerkraut, kimchi, kefir, or yogurt to naturally replenish beneficial bacteria. For MRI scans with gadolinium contrast, prevention is key. First, ask your doctor if the MRI can be done without contrast. Many times, it can provide sufficient information without the gadolinium. If contrast is absolutely necessary, make sure your kidney function is normal before the procedure. After the scan, focus on supporting your body's natural detoxification processes. Drink plenty of clean water. Consider using a sauna if you have access to one, as sweating can help eliminate heavy metals. Eat cilantro and chlorella, which have been shown to support heavy metal detoxification. And consider working with a functional medicine practitioner who can guide you through a proper chelation protocol if you've had multiple gadolinium-enhanced MRIs. Here's something crucial that many people don't realize. The inflammatory effects of these tests can be cumulative. If you've had multiple contrast studies over the years, your body may be dealing with a chronic inflammatory burden that no one has connected to those procedures. This is especially true for people with chronic conditions who undergo frequent imaging or diagnostic tests. I want to share one final story that brings all of this together. Mr. Thomas Anderson, an 81-year-old retired teacher, came to see me after what he described as a year of declining health that no one could explain. Over that year, he'd had a CT scan with contrast for kidney stones, a cardiac catheterization for chest pain, a colonoscopy for screening, and 2 MRI scans with gadolinium for back pain. Each test was medically justified. Each test came back either normal or showed minor issues that didn't require intervention. But Thomas felt worse after each procedure, and the effects seemed to compound. When I first met Thomas, he could barely walk into my office without his wife's assistance. He was confused, weak, in constant pain, and had lost 20 pounds. His family was terrified they were losing him. I reviewed his entire medical history and noticed the pattern of procedures. I ran comprehensive inflammatory markers, toxic metal screening, gut function tests, and microbiome analysis. The results painted a clear picture. Thomas was suffering from chronic systemic inflammation, triggered and perpetuated by the cumulative effects of multiple diagnostic procedures, combined with inadequate recovery support after each one. Thomas's treatment was intensive. We focused on reducing inflammation with targeted nutrition and supplements, supporting his detoxification pathways, rebuilding his gut health, and giving his body the time and resources it needed to heal. It took 6 months, but Thomas made a remarkable recovery. The last time I saw him, he walked into my office unaided, had gained back the weight, and told me he'd just returned from a trip to visit his grandchildren. His wife, with tears of gratitude, said, "You gave us our husband and father back." So what's the bottom line here? Medical tests are essential tools for diagnosis and screening. They save lives every single day. But they're not without consequences, especially when it comes to triggering inflammation in our bodies. The key is being informed, asking questions, and taking proactive steps to protect yourself before and after these procedures. If you're scheduled for any contrast-enhanced imaging or invasive diagnostic procedure, talk to your doctor about these inflammatory risks. Ask what you can do to minimize them. If your doctor dismisses your concerns, don't be afraid to seek a second opinion or find a practitioner who understands functional and integrative medicine approaches. Your health is too important to leave to chance. Remember Margaret, my patient from the beginning? Once we identified that her symptoms stemmed from the inflammatory response to her diagnostic procedures and implemented a comprehensive recovery protocol, she returned to her morning walks, her memory improved, and she told me she felt like herself again. That's what I want for each of you. The knowledge and tools to protect yourself even while getting the medical care you need. I want to emphasize that this information is not meant to scare you or make you refuse necessary medical tests. It's meant to empower you to be an active participant in your healthcare. Ask questions, prepare your body, and support your recovery. Your body has an incredible capacity to heal when given the right support. Before we wrap up, please hit that like button if you found this information valuable, and don't forget to subscribe to this channel for more evidence-based health information. Drop a comment below sharing your experiences with any of these tests or letting me know what topics you'd like me to cover next. I read every comment and use your feedback to create content that truly serves you. And one last thing, if you're experiencing unexplained symptoms that started after a diagnostic test, don't ignore them. Talk to your healthcare provider. If they're not taking your concerns seriously, find someone who will. You know your body better than anyone else. Trust your instincts and advocate for yourself. Thank you for watching, and remember, informed patients are empowered patients. Take care of yourself, and I'll see you in the next video.